you? Great to hear. My name's Dr. Calliope. Can I please confirm your name and date of birth? Oh, that's interesting. Can you just repeat that first name again for me? Okay. Trash Boat Jones. Okay. Interesting enough. And what was your date of birth again? Millennials. Gotcha. Okay. You know, I feel like I've seen you here before. No? First time? Okay. Bet I've seen you before. Well, let me just sanitize my hands here. So, we are doing a cardiac exam today. Is that correct? Okay. Is there any particular reason that we're performing this exam? Anything you are concerned with? Okay. Just general checkup. Not a bad idea. Do you have any current pain or illness going on right now? Sure. I think everybody's still kind of getting over allergies, right? But nothing serious. Alright, and do you personally have any cardiac history I should be aware of? Okay, born with a heart murmur. And that went away, I presume? Okay, good. And any family cardiac history? Heart attacks, heart disease, anything of that sort? Okay. Alright, and do you smoke? Okay. Alright, so my nurse did take your vitals, correct? Okay. But we did leave out the blood pressure. Great. Set this down. I will be taking notes from time to time. This is record keeping, and the more notes I have for in the future, the better clues I have to help you out in any way I can. Okay? Great. So during this examination, I'm going to be examining, of course. I'll be inspecting certain parts of your body, be doing your blood pressure, we'll be listening to your heart sounds in different areas, be checking your pulses and whatnot. None of this should be invasive whatsoever. And if you're uncomfortable or if you have any sort of pain, please let me know. We can stop. We can discuss. Okay. Alright. I'll only go at the pace you want me to. So, again, let me know if it doesn't feel right. It's not supposed to happen. Okay? Is it okay if I touch you? Wonderful. Okay. So, I've got my sphygmomanometer. And do you have any preference as to which arm I measure your blood pressure with? Okay, we'll do this arm then. I'm going to wrap this quite firmly right there. I'm going to put that tube right along the vein. So I'm going to take your blood pressure twice. The first time I'm going to hold your radial pulse and we'll take your blood pressure that way. Second time I'll get out my stethoscope and we'll do it that way. Okay? Great. So just relax your arm. Great. And Great. And now I want you to hold onto that for me for a second, okay? Okay. All right. Now I'm going to put the stethoscope right at the inside crook of your elbow, and we'll do that again. Okay, ready? Okay, great. Yeah, blood pressure sounds, or rather, looks pretty great. I'm just going to pull that off here. Okay. We won't be needing that for the duration of our visit. So, I'm going to take a few notes. Okay. Millimeters mercury. There we go. And then those are the millimeters mercury. There we go. Okay. So for this examination, at the very moment, I'm going to have you lie back onto the table, okay? Yep, just lie down. Get comfortable. Okay. I'm going to step back, and I just want to take a general look at you. You're not having any trouble breathing, right? Okay, you don't look like it. Pallor looks good. Okay, good. Alright, so I want you to hold your hands out for me. I want you to put your palms down, okay? I just want to inspect your hands and fingers. Looking at the pallor, looking for edema. Anything that tells me that something could be going wrong. Okay, and can you flip your hands over for me? Okay, great. I'm just going to feel on your hand a little bit. Okay, and the other hand. Great. I want you to flip those over once more. And I'm going to check your nails. Your nails say a lot about your health, and that's not excluding your heart either. Okay. Alright, while I have your nails here, I'm going to check the capillary refill time. I'm just going to press quite firmly on your nail and quickly release it. Okay, cap refill time is less than 2 seconds. The other hand, press quite firmly and release. Okay, great. Okay. Now I want you to put your fingernails together for me, okay? Just put them together like that. And let me have a look. Great, okay. So with that, what I'm looking for is a phenomena called clubbing. And I'm looking for this little tiny window. I don't know if you can see it. Little tiny window in between your fingers. And that kind of tells me whether your hands are all swollen up or doing the clubbing thing, which is not good, but you don't have that. Okay. Great. So I want you to hold out your arms again, and I'm just going to be pressing lightly along your arms, and I just want to assess the temperature. All feels warm to the touch. All feels same temperature. So I'm going to be now feeling the pulse, your radial pulse in your wrist. I'm going to grab this other arm since I've been using this one quite a bit. I want you to lay out your arm for me. Great. I'm going to be feeling your radial pulse. Okay. And now I'm going to feel both pulses at the same time, both wrists. Okay. I'm looking for any kind of delay. Okay, and those are synced up. Great. Okay. And I want to feel your brachial pulse. Okay. So I'm going to be feeling on the inside of your elbow. Okay. Alright, that one's coming in nice and strong. And the other. Brilliant. Okay. So now I want you to just hold out your arm again. I'm going to look for something called a collapsing pulse, okay? So I'm going to be feeling your pulse in your wrist, and then I'm going to bring your arm up kind of fast, and we're going to feel for a collapsing pulse, okay? So here I'm going to feel this, and then bring your arm up. Okay, set that back down. Now I am going to have you lay back, please. Okay. And I'm going to be listening to your carotid artery in your neck on both sides, okay? I'm going to be listening with the bell of my stethoscope. Most of the time you see the doctors listen with this end. However, we're going to listen with the bell end. Let me get situated. Alright, I'm going to come in quite close and just want you to breathe normally for a second. Okay? And then when I'm listening, when I press the stethoscope against your neck, I want you to hold your breath, okay? Okay, great. Ready? Okay. Alright. Yep, keep your breath held. Just listening to the pulse in your carotid artery. Okay. Alright, do you want to take a breath? Breathe in and breathe out. Great. Listen to the other side. Okay. Yep, keep your breath held. Alright, very good. So I did not hear any bruise, which is a very good sign. Now I want to palpate your carotid artery, okay? This might be a little uncomfortable. It's not going to be painful though, okay? Okay, I'm just gonna come over here and feel. There we go. Great. Feel the other side here. Great. Take a couple notes. Okay. Now make sure that you're laid back. Great. Great. Okay. Now I'm going to have you turn your head to the left. This would be my left side. Turn your head to the left. I want you at a 45-degree angle. Great. Just going to watch your carotid. Do you have any pain in your stomach currently? Great. I'm going to press quite firmly on your stomach. Well, your liver, actually. I want to look for a special kind of reflux. I'm going to press, watch. Okay, and release. Great. You can turn your head back to center. Okay. Now I want to take a look at your face and your eyes. Okay. So let me just get a good look at this gorgeous face of yours. And now I want to take a look at your eyes, okay? Shine this light just so I can see a little bit better, okay? So what I'm going to do is I'm going to pull down on your eyelid. I want you to look up, okay? Look down, look up for me. Look up, look up. Great. And now I'm going to pull up on that same eyelid, and I want you to look down, okay? Pulling up, look down, look down, look down. Great. And the other side, I'm going to pull down on this eyelid, look up, look up. Great. And I'm going to pull up, look down, look down. Okay. Blink a couple times. Great. Now I want you to open your mouth, okay? Just want to take a quick peek. Okay, teeth look great. Inside your mouth's looking really good. Okay. Can you touch your tongue, tip your tongue to the roof of your mouth for me? There we go. All right, that's all looking good. So now I want to look at your chest again, please. What I'm looking for primarily here is any scars. You haven't had any sort of heart surgeries, have you? No. No sort of chest surgeries whatsoever? Okay. Would you mind lifting your left arm for me? And your right arm. Okay. Great. We're going to be getting a little more up close and personal again. I'm going to be feeling around your chest now, right? So first I want to palpate your apex beat. So what I'm going to do is I'm going to go to the mid-clavicular line here and down to the 5th intercostal space. And just place my hand there. Great. Okay. Alright. So now I want to feel around your chest in a few different places. I'm going to be feeling for a phenomena called thrills, which are basically heart murmurs that I can actually feel, that are palpable. Okay? I'll be feeling each of the 4 valves for that. Okay. We're going to start with the mitral valve. Okay, the tricuspid. Pulmonary. Good. And aortic. Okay, I don't feel any thrills at all. Now I'm going to auscultate with my stethoscope. So again, I'm going to be listening to those 4 valves. Alright, you can just breathe normally, okay? Alright, again, we're going to listen to the mitral. Okay, tricuspid. Great. And pulmonary. And the aortic. Okay, that all sounds normal. I'm going to switch to the bell of my stethoscope and I'm going to listen to those 4 valves once more. So again, mitral. Good. Good. Tricuspid. Good. Okay, pulmonary. Very good. Okay. Make a couple more notes. Okay, we're going to do a couple of tests so I can detect any sort of problems with certain valves. So first thing I want to do is I'm going to listen to the aortic valve, and then I'm going to have you sit up when I ask you to, okay? All right. Listen to the aortic valve. Okay, and sit up for me. Great. Breathe in. Breathe out. And hold that out breath. Yep, hold your breath. Good. Okay. You can lay back down. Breathe normally. Give you a second. Okay. Now we're going to do a test with the mitral valve. Okay. So I'm going to hold the stethoscope on the mitral valve. Okay, I'm going to listen to it, and then I'm going to have you roll onto your left side, okay? Okay. And breathe in. Breathe out. And hold that exhale. Hold your breath. Very good. Okay. All right. Now I want to take a listen to your lungs and check your back for a couple things, okay? All right. So I want you to sit up for me. Sit up. Good. Okay. And I'm going to come around and I'm going to listen to your back, okay? So I'm going to listen kind of in the middle of your back, the bottom of the lungs. Breathe in. Breathe out. Breathe in. Breathe out. Okay, and the other side. Breathe in. Breathe out. Breathe in. And out. Okay, good. And we're no crackles in your lungs. It's very good. Lung sounds are normal. Now I'm going to be feeling at your sacrum, okay? Be checking for sacral edema. Okay. All right, nothing there. And now I'm going to be feeling your feet, okay? And check for any pedal edema, okay? All right, there we go. Okay, just gonna feel around here. Okay. And check your pulses here too. Okay, alright, that all looks really good. Let me make just a few more notes. Okay, so to finish this cardiac exam, I want to order an EKG, and let's go ahead and do some blood work while we're at it. Okay. Yep, you can take a visit downstairs, and the receptionist will tell you exactly where you need to go, okay? All right. So far, I didn't see anything out of the ordinary. There weren't any irregular beats. Your chest sounded and looked pretty good. Your lungs sounded great. No bruise. Carotid arteries great. Everything looks really good. You look really healthy for your age. I am quite pleased with that, I must admit. So I'm going to put this down. And just re-sanitize my hands. Okay. So it was an absolute pleasure working with you, and I'm quite glad that we didn't find anything, so I don't have to see you in any sort of dire circumstances. Okay? All right. It was a pleasure. and I hope to see you again for another checkup. Okay, great. So you can go talk to the receptionist on your way out and get that EKG, and then we should be able to get those results back to you pretty quickly. Okay. Okay. I hope you have a whale of a day. I'll see you later.